Carpal tunnel syndrome is a very common problem that we see in our aging population. Contrary to what people think, repetitive labor is not a cause of carpal tunnel syndrome. We've found that it really is in the people who have a stronger tendency towards arthritis. It's an inflammatory problem, and oftentimes it can be treated without surgery. Activity modifications, the changing of your workstation, the setup of your computer and your mouse on your desk, the changing the positioning of your hands and arms in relation to how you do your work is probably the first line of treatment for carpal tunnel syndrome in the workplace. If your symptoms are not controlled by simple activities, by simple activity modifications, then we'll generally recommend bracing at night. Cortisone injections into the carpal tunnel are also a treatment, and then the final phase of treatment, if your carpal tunnel syndrome is significant, is a surgery. The surgery is done through a very small incision. Recovery time is very quick now, and the symptoms are, and it controls the symptoms and gets people back to their normal activities quite rapidly. So if you have numbness and tingling in your fingers, and it's to the point where it's happening with a very minimal activity, or even with no activity at all, if your numbness and tingling affects your ability to sleep at night, then I think that you should seek treatment.